Hi, I'm Dr. Miceli, and I'm excited to talk to people with type 2 diabetes and offer them some help. And that passion goes back to when I was much younger and my grandfather actually passed away from type 2 diabetes complications. And really ever since then, I've always wanted to help people with type 2 diabetes. And I just hope that the information that I have for you guys sitting there at home, listening, watching, really helps you and changed your life in a big way. So type 2 diabetes, let's talk about that. It's insulin resistance. That's the term attached to type 2 diabetes as opposed to type 1 diabetes, which is insulin dependent diabetes. Those people, they actually don't make enough insulin. Type 2 diabetics make plenty of insulin. They have plenty of that hormone, and they just can't use it. You guys can't use it. If you're type 2 diabetic, you make it, it just doesn't work. So that's insulin resistance or type 2 diabetes. Now, if you could imagine that insulin is like a key, okay? And there's like a lock, and this key fits in a lock, and when it goes in the lock, it clicks, and then this door opens. And the doors that open, that's what allows the blood sugar, okay, to go into the cells where it belongs. That place in the cells is where you're going to manufacture or make energy, like little power plants, okay? So imagine if you have insulin resistance or key resistance, if you will. So the key won't fit into the lock, therefore the doors won't open, and the blood sugar will not be allowed to go into the cells. Instead, it will stay in the blood. If it stays in the blood, it piles up there, and then you have high blood sugar. And then once you go for a blood test, they say, you have high blood sugar, you have diabetes, you need to eat better, exercise, lose weight. Good luck. If you don't do that, we're gonna put you on medication, and if you're still not doing a good job of that, we're gonna put you on more and more medication, right? Seems like every time you go to the doctor, they wanna put you on more pills. And you go, when does this end? It doesn't. That's the sad thing. So let's go back and talk about the eat better, exercise, and lose weight. Okay, so the first one is eat better. That's what you're supposed to do. Well, how are you supposed to eat? Oh, you know, don't eat sugars and things. Well, okay, gee, thanks. That's helpful, but really, what are you supposed to eat? Now they say, don't eat white bread. Eat whole wheat instead. That's good advice, unless you have a sensitivity to gluten that you don't know about, and that sensitivity causes more inflammation in your body. And anytime you have inflammation in your body, and then your blood sugars go up every single time. Any of you who've ever gotten sick out there that have diabetes, you know that when you get sick, your blood sugars go up most times. The reason why is because your immune system uses inflammation to solve problems. So if you get sick, you get more inflammation to help solve the sick problem, and your blood sugar goes up. So if you're eating foods, and those could be any foods, it could be carrots or potatoes or like you name it, things that you think are really healthy for you, right? It could be some of those foods. You could be eating some foods like that cause inflammation in your body. They irritate your immune system for some reason. And you don't have like an outward reaction, you have an inward reaction, you have higher blood sugars. I had a patient one time who, it was the strangest thing, I thought it was unique. She, every time she ate eggs, her blood sugars doubled from eggs. Who would have thought? Okay, so it's important to know what to eat, number one. But there's not really a good guide out there because the guides are kind of like catch all, do all, whatever. And what you really need is an individual plan just for you, because every person is unique and different. So let's move to the other thing. You need to exercise. Well, gee, if you've got high blood sugar, chances are you don't have very much energy. Why? Because you need to be getting that sugar, remember, into the cell where you make energy. And if you can't do that, you're not gonna have much energy. So good luck working out, right? It's really hard. So the third thing is you need to lose weight. Well, if you have diabetes, your body's gonna try and compensate, or the medications that you're gonna take if you're on diabetes, a lot of them cause the insulin levels to go very, very, very high, or your body's compensating and already raising the insulin levels. Now you've got really, really high insulin levels, okay, to try and compensate for this blood sugar problem, to try and offset it. And the thing about insulin is it's a fat-storing hormone. So now you're caught in this vicious cycle where this excess hormone that you have to try and deal with your problem is making you fat. And yet you're supposed to lose weight so that your sugars can go down. Very difficult. So a lot of frustrations across the board for type 2 diabetics with these things. So one of the things that you really need to understand if you've got type 2 diabetes is you're different. You're different than the type 2 diabetic next door to you, and you're different than your aunt who has type 2 diabetes or your friend or your whoever. Everybody's different. And blood sugars go up or down for different reasons. There are so many different things that involve blood sugar regulation, and most people are completely unaware of it, and a lot of doctors discount them or don't think about them, or maybe they've forgotten about it, or maybe they never learned. But adrenal glands are a big factor in diabetes. Your adrenal glands produce a hormone called cortisol. Cortisol's job is to raise blood sugar. Well, gee, have you ever had your cortisol levels tested? Because what if they're too high? Your blood sugar will be high. So, and you can see evidence of that if anybody has ever gotten a steroid shot that has type 2 diabetes. If you get a corticosteroid shot, sugars way up. So you've seen evidence of that, how that cortisol can affect your blood sugars. Immune system was one, we kind of touched on that already. Your gut, how that functions, since most of your immune system lives in your gut. That's very important as well. Not only the foods we eat, stress is another thing. There are so many things. I can keep just listing things on and on and on that affect blood sugars. My point is diabetes is simply a label. It's a disease, yes, but it's a label, and it's just what we call people that have high blood sugar. It doesn't explain why the sugar is high. There are tests and there are things that do explain why the sugars are high. And when you start to find those things and you start to solve them one at a time, you can reverse diabetes. You can take somebody, it's done it, I can't even count how many times, where we have people that come in and they're on a whole bag of medications. And after a couple months, 2-3 months, blood sugars went from 400 to 100, and they're off those medications. They're off their insulin shots, they're off their oral medications, they're off their blood pressure pills, their cholesterol pills, because that usually seems to go along with diabetes for other reasons that are not very difficult to explain. But there's all these factors that play a role, liver function, all this kind of stuff. And people say, well, I've had blood work done, well, I've had this stuff. Yeah, the basic stuff. So there's a whole other world out there of additional tests and other things that can be done that can definitely shed some real light on why somebody has a problem controlling their blood sugars. So I invite you guys, if you're watching and you got some great information, I hope this helped you. I hope this maybe changed your life. If any of you are wondering if you might be able to get some help with your sugars, or you're really struggling with them, don't hesitate, give us a call. We'd love to sit down with you. We'd love to talk with you and see if we can help you.
If you have been diagnosed with type 2 diabetes, call us today to get the answers you're looking for. Type 2 diabetes can be reversed. Don't wait any longer. Call 615-771-8552. Call now.